Assalamu alaikum. I'm Dr. Abdul Hakim Jum'a, and in this video, we'll cover the protective equipment required when dealing with a suspected case of the Ebola virus. Throughout the year, the Ministry of Health and Center for Disease Control guidelines are provided to reduce healthcare workers' risk of infections. Resources to protect healthcare workers from infectious disease are called personal protective equipment, or PPE. When caring for a patient, entry into patient room or care area with a suspected or confirmed case of Ebola virus, you should perform hand hygiene and wear all of the following equipment: gloves, gown or bodysuit, fluid resistant or impermeable, face shield for eye protection, and an N95 mask. If patients with Ebola virus start to hemorrhage, vomit, and have diarrhea, or large amounts of other body fluids such as blood are present in the environment, additional personal protective equipment must be worn. Extra personal protective equipment may include full body or overall waterproof suit that covers the whole body from head to ankles, double gloving, including outer pair of long-sleeve nitrile gloves, disposable shoe or boot covers. As with any isolation situation, when you exit the patient's room, ensure that you discard your personal protective equipment without contaminating your eyes, mucous membranes, or clothing with potentially infectious materials. The Center for Disease Control recommends you take off your personal protective equipment in this order: gloves, face shield, gown, and mask. Very thorough hand washing should be performed immediately after removing personal protective equipment. Personal protective equipment exists to protect you and your healthcare team by reducing the risk for hospital-acquired infection of Ebola virus. Taking the time to properly put on and remove all required equipment will protect health workers, even in the event of caring for patients with Ebola virus.